Are you ready to make a difference in the lives of others? If so, then you should consider becoming a recovery coach. Recovery coaches are trained to help people in recovery, seeking recovery, or struggling with addiction. They provide support, guidance, and resources to help people on their recovery journey. CCAR Training is the leading provider of recovery coach training programs. Our programs are designed to teach you the skills and knowledge, what we call the science, while giving you an understanding of your own art needed to be a successful recovery coach. We offer a variety of training options, most offered online. If you're interested in becoming a recovery coach or just learning more, I encourage you to visit our website or contact us today. We would be happy to answer any questions you have and help you get started on your journey to becoming a recovery coach. We hope you'll visit us at www.addictionrecoverytraining.org to learn more.
Are you in the recovery field and looking to expand your knowledge of the many pathways to recovery? Do you want to network with the nation's leading recovery leaders? If so, then the Multiple Pathways of Recovery Conference is for you. CCAR, Recovery Iowa, and the Iowa Department of Health and Human Services are bringing the message of multiple pathways to our friends in the Midwest. Join us August 21st through the 23rd at the Embassy Suites in Des Moines, Iowa for the National Recovery Conference, where we share and educate one another about the many different pathways, methods, practices, programs, and belief systems recoveries can use to enhance their recovery journey and sustain long-term recovery. Whether it's a 12-step, secular, a spiritual religious modality, medication-assisted recovery, or wellness-based and sober active communities, we've got you covered. At MPRC, you'll have the opportunity to connect with the recovery community, broaden your knowledge of the multiple pathways, and be refreshed in your journey of recovery, whatever that may be. So don't miss out on this incredible opportunity. Tickets are on sale now at ccarconference.org. That's ccarconference.org. The Multiple Pathways to Recovery Conference, the National Recovery Conference, where all pathways to recovery meet.
Join us on the Recovery Matters podcast, where we celebrate the power of resilience and explore multiple pathways to recovery.
So here we are at the Recovery Matters podcast. Our guest today is Corri Mercy. You're in Colorado, right?
I am in Colorado Springs.
So this is the Recovery Matters podcast. What matter about recovery would you like to speak about first and foremost?
I would like to talk about harm reduction.
Wait, harm reduction's not recovery.
Yeah, a lot of people think that, and I'm here to prove you wrong, or at least give you another perspective about that.
Okay. You know, I was just teasing about that.
Oh, I absolutely do.
Okay. So, but when people say that harm reduction is not recovery, what are they usually thinking when you mention harm reduction? Why would they say that?
I think harm reduction, when people think about harm reduction, the first thing that comes to mind is like overdose prevention sites, or the sites where people are using under supervision, or like syringe exchange programs, things that are very, I don't want to say extreme, but very like far to one side of harm reduction, when harm reduction is truly a spectrum. And so when I talk to people about harm reduction and they're like, well, you can't be in recovery and utilizing harm reduction, my challenge to that is that recovery through a harm reduction lens is any positive change that someone can make in order to help them live a healthier, a safer, and a more autonomous life for themselves.
So positive is healthier, safer, and more autonomy.
Yeah, absolutely.
Oh.
One of the core principles of harm reduction is autonomy, and being able to really just make sure that the individuals that we support through harm reduction are able to live a self-directed life, meaning that they are able to make choices for themselves, and we are empowering them in those choices, because we believe that individuals who are in recovery or who are using substances are the experts of their own lives. I don't know much about your life. You are the expert of your life, and I am the expert of my life. And that's how we like to conduct harm reduction.
Have you taken the CCAR Recovery Coach Academy?
I have not.
Because that is It sounded like you could facilitate it with what you just said about how we treat people as a resource on their own life. So beautifully said, Corey. I appreciate you very much already. So thank you. How'd you get interested in harm reduction?
That's a fun question. I feel like I'm gonna talk for a while about this one.
Good, because that makes my job a lot easier.
Well, perfect, perfect. Happy to help.
Hmm.
Um, so I actually was 100% abstinence based, and working in for-profit treatment 4 years ago, 4 or 5 years ago. So I actually stopped using opioids a little over 8 years ago. I just celebrated 8 years on July 24th, which is also my birthday. Um,
Congratulations.
Thank you so much. It's
Hmm.
very exciting. And I grew up in a very small town in Michigan where we had like two AA meetings, and that was pretty much it.
Hmm.
So when I stopped using, I was looking for something that was going to support me. And I would also like to note that harm reduction practices actually did support me while I was still actively using. Um, but when I moved to Colorado, I moved out here because I got a job in treatment. I was a behavioral health technician on a detox unit, which
Okay, so what is a behavioral health technician?
excellent question. It's like when you're not quite educated enough to be a therapist or a case
Oh.
manager. And so they're like, we're going to stick you right here and you're going to do all of the grunt work that no one else wants to do. But also, you're going to run groups sometimes, but also you're in charge of like 8 clients by yourself. So,
Well, I think
um,
when you have the title technician, it implies a certain level of expertise or competence. So,
yeah,
yeah.
yeah.
Hmm.
No, I actually really enjoyed that job. I talked a lot of crap about it, but I enjoyed that job a lot.
Hmm.
So I was working in treatment. I transitioned from that role into a more education-based role and eventually became the director of case management at a for-profit treatment center here in Colorado.
Hmm.
Um, that job was wonderful because of the people that I met and the clients that I got to serve. And very challenging and difficult because I worked for people who viewed recovery and our clients as a business instead of an opportunity to help people. And that should have been my first indicator that I was meant for the nonprofit world, but it took me a whole other year to figure that out.
I can't let you just roll right past that statement. So,
Okay.
talk to me a little bit. What was your first indication that this was more about a business than it was about the people?
Yeah, the biggest one was the lack of accessibility that this environment, and I don't just want to call out, I'm not calling any treatment center out because I'm not using names,
Right.
but I do think as a whole, calling out the industry is important here because any for-profit treatment center, I've not worked in a treatment center where the phrase at the end of the day, it's a business has not been thrown around. And
Hmm.
that changed a lot when I moved into the nonprofit world, but that's for later.
Do
Um,
you have a specific example?
the lack of accessibility, I think, is best encompassed by two things in my experience, and that is the lack of financial resources and accessibility. I've seen a lot of clients come through in what we would call like a revolving door kind of
Hmm.
sense of coming into treatment and going through the phases and then having a reoccurrence of their use and needing to go through treatment again. And each time we were charging these families, these individuals, upwards of $40,000 for a 30-day stay, which is about the median price of a 30-day treatment stay in the United States. And the lack of accessibility came into play for me when I realized that insurance can only be billed a certain amount of times in a year based on severity. So if you're not sick enough, you can't get help, which does, in my mind, speak to a lack of accessibility for people who maybe don't want to hit their quote unquote rock bottom, but want treatment before that point. Um, and then the other accessibility issue that I have seen that I would really like to highlight is the lack of, I think, ability or resource to support people with unique circumstances. Um, and what I mean when I say that is there are significantly more treatment centers across the US that support men versus women. We actually closed our women's treatment program during COVID. And so that meant there were only 2 treatment centers in the entirety of Colorado Springs that were taking women. And so the other thing is there was absolutely no resources to support pregnant women, or pregnant people in general. And that was a big deal for me to see clients who were coming in and we were like, we can't support you because you have a unique medical concern, like a pre-existing chronic health condition, or we can't support you because you're pregnant right now, or all of these other things. And it's like, I understand that we can't support everyone and we can't help or save everybody, but why aren't we trying a little bit harder to support the people that are coming to us, that want help, that want to be engaged in treatment?
So, do you have a certain example or a person or an actual like real life story that would highlight that?
Yeah, I do. I have a couple actually. So one client in particular, I will call him A. A was 18 the first time that he entered into treatment. I was his case manager. We were super short staffed, so director of case management had a full client caseload as well as management duties. And he was a wreck. Honestly, like I've been there too, but he had come off the streets. His family had found him after over a year of being unhoused, as a teenager, and he was coming into our treatment program unwillingly, but with the desire for a roof over his head. And so we took him. And he was incredibly difficult to kind of corral, I guess, in like group settings,
He was non-compliant.
Yeah, it's not my favorite phrase.
I know.
But yes,
You were looking for another word.
I was. And for some reason, I think A reminded me of my younger brother, honestly. And
Yeah,
so
yeah.
I was like, all right, you know what? I am like committed to this and I am going to support this kid and we're gonna get through this together. He hated me, to be fair. He hated me, which is valid because I was trying to get him to do things that he didn't want to do. You know, we were going through the whole treatment continuum. I worked incredibly hard with A, and for A in order to support him in early stages of his sobriety. He was chronically using methamphetamine and heroin. And when we had conversations, he was like, I don't want to stop using weed. I don't care about the other stuff, but I don't want to stop using weed. And I was like, at the time, you know, I was like 100% abstinence-based. It was like, if you smoke weed, you're going to start using methamphetamine again, which actually doesn't make any sense when you think about it logically. They're not even close to the same kind of drug. But A was discharged early for his noncompliance, and I was able to set him up with a discharge plan that supported him for about 4 months until the sober living home that he was at kicked him out for smoking marijuana. He didn't have anything else in his system, but he did have marijuana in his system. His family could pay, and they did pay for a second stay in our treatment program. So we're looking at total treatment costs coming up on $90,000 total. And he was in our program for 2 weeks before he was kicked out for noncompliance, again, for smoking marijuana. I was essentially told that he was a lost cause and he was not going to be someone that we would support again, and that I shouldn't, quoting verbatim, I shouldn't waste my time to find him another plan because he wasn't going to follow through. And that broke my big sister heart a lot. And I said, like, F that. And that was the first moment that I was like, what could we be doing differently? And what are we doing right now that is not supporting all clients, to the best of our ability? So I found him, I sent him and called his mom and gave her the same resources, a list of like shelters that would take him, a list of places. Thankfully, in the spring, here in Colorado Springs, we do have a youth shelter that is more harm reduction focused. So I was able to set him up with that in a place where he wouldn't be like kicked out if they didn't drug test. He wouldn't be kicked out if they found like a joint or something. And I think what's really unique about this story is that it was the first time that I really had to look at myself and say, how have I been contributing to the harm that like
Mhm.
abstinence only mindsets kind of take towards clients? I would like to fast forward a little bit
Well,
to 2 years ago.
well, let me just jump in real quick and say
Yeah.
your story is an incredible example of what I learned from Bill White many, many, many years ago, where he said that people show up to treatment with a chronic relapsing condition. That's why they go to treatment. And then when somebody actually uses a substance while they're in treatment, they have confirmed the diagnosis, right? Or affirmed the diagnosis. And
Yeah.
so what providers do then is kick the people out for confirming the diagnosis. It's like you went to the hospital, right? And you had chest pains and they said you had a heart problem. Then you have other chest pains 3 days later. They don't kick you out because maybe you had a cheeseburger or something that the day before. They treat you. So
Mhm.
I think that's admirable that you are self-aware enough to know that something's not right with this picture. So go ahead now, pick up where you left off.
I think it's important to note too that I wasn't always that self-aware. I wasn't
I
even
know,
like half the self-aware too.
right?
When I moved to Colorado, I immediately got started in my certification courses for becoming a certified addiction counselor. And I learned a lot. I learned so much, but none of what we talked about even mentioned harm reduction or mentioned like overdose prevention strategies, which is crazy because now I have Narcan literally sitting on my desk next to me.
Hmm.
And it's with me all the time now. But yeah, and so it took so much work, and it's still work that I feel like I'm actively doing.
Oh yeah.
But to fast forward, so let's see. I entered treatment about 4 years ago. Um, I started working in harm reduction, um, actively within my community for a nonprofit a little over 3 years ago. One of the first outreaches that we did a lot of outreach work with our unhoused community. Not everyone who uses drugs is unhoused, and not everyone who's unhoused uses
Mhm.
drugs, but there is a good amount of overlap. And there's one encampment here that we focused pretty heavily on as far as supporting. So once a week, we would go out with like sandwiches, seasonal things that were supportive, like sunscreen in the summer and socks and gloves in the winter, stuff like that. But we also took Narcan and fentanyl test strips out and said, hey, if you or somebody you know needs these, you should take this. And it was pretty rare that we would not go through the 30 boxes that we took with us. But on one particular outreach, I was walking around talking to some people that we saw pretty regularly, and I noticed a kid that I hadn't seen before. And I looked and it was A. And I walked up to him and I said, do you remember me? And he said, I remember you. I hated you. And I was like, that makes sense. Okay. And I was like, that's fair. How are you? And he said, I think you're the only person out here that knows my real name. And that kind of broke my heart. And I was talking to him and I said, how long have you been like living in this encampment? And he said that he had gotten kicked out of a sober living home for smoking weed. He also shared with me that he had been diagnosed with a chronic pain condition. And that made a lot of sense to me because he had reported chronic pain to us as early as the first day he was in treatment. And everyone was like, well, it's just, you're just detoxing. Like you're in pain because you're detoxing, which like, yeah, you're in pain because you're detoxing. But also if someone keeps reporting that, we should listen to them.
Right.
So he shared with me that he wasn't able to access traditional routes of treatment because he didn't have insurance, because he didn't have a permanent address, and because he didn't have the funds to do so. And so that he had been smoking weed, but he was trying really hard to not do other things to manage the pain. I saw in that encampment every week for the fall for several weeks. And the last week that I was at that job before I resigned, and kind of moved on to the organization I'm with now, I saw him and he let me know that he had just been accepted into a harm reduction focused sober living home. It's not a sober living home, it's a supportive housing
Hmm.
home, that would allow him to smoke weed. And he was ecstatic because for the first time in over 4 years, he was going to have a permanent address. And he felt like he could maintain that. And that story is one where I didn't play the biggest role in that, aside from being an onlooker and supporting when I could. But that was one where I got to know the outcome and it was a positive one.
Well,
And that's a really
yeah.
great example of harm reduction.
Well, the message is, what if sober homes, and that's the term you use, I like recovery residents a little better. What if
Yeah.
recovery residents had allowed him just to smoke marijuana to take care of his pain? And isn't he better
Mhm.
off? And then if he wants to
Yeah.
choose what he does with his marijuana consumption, that's up to him one way or another. But
Yeah.
yeah, it's heartbreaking
Yeah.
in a lot of ways. Sandy
It
often
is.
tells a story about having a student who says he's in recovery, and about once a month, every 5 weeks, he will climb a mountain, smoke a joint, and have a mountaintop experience. And there's many people in traditional 12-step communities or old guys like me that have 30 plus years of recovery that would say he's not really in recovery, but
Mhm.
who are we to say who's in recovery or not? That's up to you.
Yeah. And I think that's like the my favorite part about harm reduction too, is that the intersections of harm reduction and recovery, they overlap so much more often than we think they do.
Oh, yeah.
And really at the root of it, like there's a lot of core principles when it comes to harm reduction, but at the root of all of them, what it comes down to is that autonomy, is that opportunity to live a life that is the best for us, not the
Hmm.
best for other people looking in from the outside, but a life of recovery, a life of harm reduction, a life in general that is rooted in what we want and what is genuinely going to be best for us.
Hmm. So tell me about your role now. What do you do?
Oh, so this is exciting because it feels really cool.
Yeah, good.
Um, so I work for a nonprofit called Nastad, which is the National Alliance of State and Territorial AIDS Directors. I had to like memorize that really hard when I was interviewing, and then they asked me what Nastad stood for when I got hired, and I was like, I don't know.
You
I
choked?
can't remember. I did. But I still got the job and it's
Yeah,
been like 8 months, so it's okay.
yeah.
So I actually work for Nastad as the manager of drug user health, one of the managers of drug user health. And my role now is to work with the Nastad Technical Assistance Center for Harm Reduction. So this Technical Assistance Center is super cool. There is a CDC website you can go to that basically says, oh, you need help or information about harm reduction, we have just the people for you. And you can submit this form, whether you're a treatment provider, an individual looking for like Narcan. We work with health departments, nonprofits, recovery residences, all kinds of different places or organizations from all over the US reach out to us and say, we have a need for training or we need data about like overdose prevention studies or safer consumption sites, all kinds of stuff. And then it's my job and the job of several other wonderful technical assistance providers to reach out to those individuals and say, how can we help? Sometimes it looks like sending people peer-reviewed studies or sending people resources we've already created. Like we have a really great xylazine wound care guide that one of my coworkers created. His name is Billy. He created that is like we've sent to so many people because xylazine is a drug that's really prevalent right now. It's everything from that to like how to open a syringe exchange program, all kinds of stuff. So it can look like sending people resources like that, or sometimes we end up flying out to their organization or event to speak at it. Um, I'm flying to Michigan next week, actually, to speak at in a very, very conservative community about harm reduction, and I'm so excited. And then I'm flying to the Multiple Pathways to Recovery conference to
That's
speak at that too.
so there's a couple things. What is a syringe exchange program?
That's a great question. A syringe exchange program is a program or facility where individuals who are actively using substances can come to dispose of their used syringes in a safe way, and also exchange them for syringes that have not been used yet, that are still sterile. This is a harm reduction method that a lot of people have big feelings about, but it's also the harm reduction method that has been widely studied and used and shown to reduce the spread of infectious disease and also increase the likelihood that individuals will enter into a treatment program or discontinue their use altogether.
Great. And what is a safe consumption site?
Safe consumption. Wow.
Yeah, I
Let me start
know.
over. A safe consumption site or an overdose prevention site is a place where individuals who are using substances can come come and be supervised while they are injecting or using their substances by a medical professional, usually a paramedic or a nurse. They can also receive sterile supplies there as well, but they can be kind of just supervised to make sure that nothing goes wrong while they are using their substance. So those facilities don't provide substances, they just provide the materials, but they also can give people like Narcan and other, like connect them to housing, other things like that too.
What are the typical arguments against safe consumption sites?
Oh, that is my favorite question. The biggest argument I hear, like what is the biggest argument against safer consumption sites, is just that we're enabling people to keep using. And my response to that is that people are going to use drugs. There is not a world where people do not use substances at this point and where we are. And people are going to use drugs at home, on the streets, wherever. We might as well give them an opportunity to do so in a space that can help them feel supported and not shamed for what they are doing. There's not a day that goes by that a person who is actively using substances, especially injecting substances, doesn't experience shame and stigma. And if we can be the individuals that support someone through that, and maybe the one person a day that doesn't shame or stigmatize someone for using, then I think that's what we should do.
Maybe it's not enough shame and stigma. If we shamed people more and stigmatized them more, wouldn't that just shame them into stopping using?
I think that's what a lot of people think. And, at the end of the day, no one ever, I think that when we shame and stigmatize people about their use, we end up with people who stopped using because they felt bad, not because they wanted to.
I also feel that shame and stigma is rooted in a very negative emotion. It's one of superiority. It's one of dislike. Extreme cases may be hate. And when you come alongside somebody in love, care, and compassion, I think that's the more powerful emotion. And really, no judgment. I'm just here to make sure, you do well and you're as healthy as can be. And I care about you. And dare I say, I love you in a brotherly, sisterly sense. And I want to see you, enjoy life, basically.
Yeah.
However that
absolutely.
may be for you, which is, it's a very difficult for a lot of people to wrap their head around.
Yeah, absolutely. It makes me think about the days that I actually worked at a syringe exchange program. There is one syringe exchange program here in Colorado Springs, and I was on the kind of opening team that started it. And when we first started, I literally stopped working in treatment, had 2 weeks off, went on a mountain road trip, came back and started working at a syringe exchange. And like the switch was wild because but I took this job and I was like, this feels right and this is what I want to do. But I was really kind of anxious about it because I was like, what if I am not actually like cut out to do this? What if I like can't put aside my own bias and my own recovery stuff in order to like support people where they are. Because, I think a lot of people say, like, my goal as a treatment provider, my goal as a therapist, whoever, my goal as a peer coach is to meet people where they're at. And that's wonderful. We should be meeting people where they're at. But harm reduction takes it one step further to say, I want to meet people where we're at and not leave them there. And that is the most powerful form of love in this kind of situation. But when I started working at this program, we were seeing like one, maybe two people a day. And it wasn't because people in our community weren't using drugs. Colorado Springs, El Paso County, Colorado has the highest overdose rates, second highest overdose rates in the entire state. So we knew people were using substances, but they weren't coming to our program. And that kind of forced us to look at why. And the biggest reason why was because we had not put ourselves out there as a safe place for people to be. So that's when we started doing outreach, and that's when we started, word of mouth, talking with people and sharing with people. And even though that program, like I left that program in January of this year, they've added a second service day. So they're open 2 days a week now, and they have more people than they know what to do with, because once word gets out that it's a safe place to be, a safe place to get supplies, a place to just be, and not have to censor yourself regarding your use, then that's when people feel the most safe to engage.
Wonderful. So tell me about your recovery. What happened and what it's like now?
That's a really interesting, it's one that I like to think about, but I don't share very often. But so I started using opioids when I was a young teenager. I was like 14. And I also should preface that I grew up in a house with a cop for a dad and a paramedic for a mom. So like I grew up, yeah. I grew up around the dinner table, like hearing about how terrible people who use drugs are, how like they are the worst of society, they are the worst ever. And so when I started using drugs, I did not feel good about myself, but I also didn't know where to turn. So fast forward to my 18th birthday, which was the last time that I used substances. I stopped using without the help of a treatment program or a formal treatment program. I will say that I kind of switched to other vices and struggled with my mental health for several years until I did seek out a professional treatment program. I think I was 20 or 21 when I did that. And I am living a life that I didn't know was possible for myself now. While I was actively using, I did utilize a syringe exchange program, which honestly saved my life, introduced me to Narcan for the first time, introduced me to safer practices for using that probably prevented, actually I can 100% say prevented me from contracting hepatitis C or HIV or another kind of like viral disease. And once I stopped using, I really just needed some time to figure out what I was actually doing. Even though I stopped using substances at 18, I don't consider my recovery to have actually, I don't consider myself to have been an active participant in my recovery until I was 22. That's because like I said, I traded it for other things when I did stop using substances.
So what happened at 22? You knew I was going to ask.
I did. As soon as I said it, I was like, oh, he's totally going to ask about that. So right before my 21st birthday, I moved to Colorado. And I was really struggling. I went through some very, very, very difficult times right after I moved. I was the victim of an assault. I was struggling really hard, and I had there was an active point where I had to make the choice between re-upping my opioid use, or choosing to acknowledge that that was not the best choice for me to make at that time, and that I was thousands of miles away from my family and I didn't really have a community yet, and that I needed support. So right after my 22nd birthday, I found a therapist that supported me through making that decision for myself. I found a therapist that sat with me on the floor of her office in discomfort and sat with me while I processed the pros and cons of using substances, the pros and cons of engaging in other self-destructive behaviors, the pros and cons of all of it. And she never once said, you shouldn't do that. She just said, what happens if you do that? And then after I poured out all of the things, she said, what happens if you choose not to do that? What happens if you choose the opposite of substance use? What happens if you choose the opposite of addiction? And that was the first time somebody had ever said to me, the opposite of addiction is connection. And so I started building a community for myself. And now I have like the most beautiful community. And it's taken a lot of work. Like that was like 5 years ago, but it's taken a lot of work to find those people and also to find my niche, because I feel like harm reduction is kind of a niche career field, but here we are. And I don't know, I feel so blessed and also proud of myself for the ways that I've shown up for myself in my version of recovery.
You could be like a diplomat or a politician though, because you avoided a lot of those answers, like with a lot with a lot of very general kind of like, I'm just gonna skim over the top about these other destructive behaviors, which is fine, Corri. There's no problem with that. But I just want to let you know, I noticed that. That's perfectly okay. How do you take care of your recovery today? What does that look like for you? And do you say you're in recovery?
Usually when I tell people that I'm in recovery, I don't say in recovery. Because if we're being totally honest, like I occasionally do smoke weed and I occasionally have a glass of wine. So I know, oh my God, I know, I'm the worst.
Melvin, I don't know, should we keep her on the podcast? No, I'm just kidding.
Well, and on that note, there's a couple rules I have for myself within those things.
Great.
I do not engage in any kind of substance use after having a bad day. I don't use.
How do you define a bad day?
Well, listen, COVID meant there were a lot of bad days. That's actually how those rules came about.
I gotcha.
If I am feeling any emotion that is rooted in feeling bad about myself or like I need to do something to cope with the feeling, I don't engage in substance use. So instead I will go for a walk or move my body or do something to kind of get some endorphins going. I'll spend time with someone that I care about, something, hang out with my cat, there's lots of options. And yeah, so the use that I have or that I engage in is I hate the word recreational for that, but like recreational, because I don't use it as a way to unwind or cope. Does it feel good? Yeah, it absolutely feels good.
That's why people use them.
Yeah, absolutely. And more than anything, I at this point use marijuana to help me sleep because I don't sleep very well, but it's something that I also have learned how to be very, very aware of. And if I feel like I'm relying on it, even a little bit, that's a moment for me to step back and say, and do kind of like a little analysis and a little like scan of how things are going within my body, within my mind. How am I doing? How am I feeling? And what purpose is this substance going to serve me?
But do you consider yourself a person in recovery? And I'm just curious. It's not really, there's not a right answer. I'm just curious.
Yeah. I don't say I'm in recovery.
Great. Do you ever, do you consider yourself that you were addicted at one time?
Yes.
Great.
Yeah.
Okay. I mean,
Um,
that's not great, but I just mean that great that you answered it so quickly.
Um, when people ask me if I'm in recovery or if I'm sharing that with somebody, I realized I started saying this and then just stopped in the middle of it. I say that I separated myself from IV drug use 8 years ago, or it's been 8 years since I discontinued my opioid use,
Hmm.
something like that. And I say that because for me, um, my substance use, definitely became a part of my personality. And I don't feel like I want my recovery to be a part of my personality. And so I think there are so many more interesting pieces to me than the fact that I used to use heroin. So,
So,
um,
so let me reframe the question then.
sure.
Instead of taking care of your recovery, how do you take care of yourself today?
That I like that question a lot.
Okay.
Um, so when I was in treatment for the other self-destructive things, which were actually an I
Yeah.
struggled with an eating disorder and with self-harm as well for
Hmm.
a really long time.
Hmm.
And when I was in treatment for those things, I started taking yoga classes, and I was like the most resistant person probably to ever take a yoga class. Like I literally, they were like, you have to go to yoga because you have to sit on your mat. Like you just have to be in the room. And I was like, cool, this sucks. You can't make me do it. And then I eventually did do it because I decided that my stubbornness was not serving me super well. And so when I left treatment a year later, I found myself in a yoga teacher training program. And so now I teach yoga and I'm also an aerial artist. So, you know, the big like circus hoop that
Really?
spins from the ceiling. I do that now. Yeah. Because I
Wow.
hate the gym, but I need to move my body.
Right.
So, that's like, and there's something really satisfying about hanging upside down and spinning so fast you feel like your eyes are gonna like pop out of your head. It's very nice.
Well, see, now
Um,
we get to know the real Corey. And the more we get to know you, the weirder and stranger you
yeah,
become, which is really, really cool. I love it.
yeah. So
I
I
think
do a
you're
lot
the
of,
first one person that it's called an aerial
mhm. It's
artist.
called, so it's what I do is called lyra, and lyra is the name for the hoop, that like hangs that you spin on. But like aerial silks and like
Oh yeah.
trapeze and stuff like that are all aerial arts. So
Do you have a hoop in your house?
I don't, but we are moving early next year, and I've been promised a hoop in my house. So,
Wow.
so,
So what else do you
uh,
do? So yoga and the lira.
yeah, so I
Yeah.
teach yoga a couple
Yeah.
times a week, and I teach recovery yoga actually too, which I've taught in treatment centers a lot more than I've taught outside of treatment centers. And I really enjoy teaching like restorative and meditative classes because they're also good for me. So besides yoga and aerial stuff, I am also an artist. I really enjoy drawing. I really enjoy painting. I did a couple of the paintings that are behind us here.
Wow.
I really enjoy just being creative and getting to kind of dig my hands into any kind of creativity that feels good for me. I started keeping art journals about 9 years ago, and I have one for every year. And they're just full of like doodles and paintings and my thoughts and my feelings. And yeah, anything that allows me to be creative. I also write poetry.
Um, yeah, I think I may have been more resistant to yoga than you, but at
Oh,
age
really?
63, I had done some over off and on, but I have just put together about 145 days of 20 minutes every morning.
That's amazing.
And it's a Yoga Go app. And I am more flexible, more stretchy, stronger than I've
Yep.
been in a long, 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 long time. I'm just like,
Yeah.
so it's simple things like, I like when you say we just got to go move our body. I just got to go do
Yeah.
that, you know? And your artwork is beautiful, by the way. So
Oh,
very
thank you.
creative. So, um, You are coming to multiple pathways in Iowa. What are you talking about?
Well, I know this might come as a surprise, but I'm going to talk about harm reduction.
Yes.
Yeah, no, I am going to talk about so last year I talked about harm reduction and the intersections of recovery within harm reduction. This year I'm going to take it a little bit of a step further and talk about how we as providers, as law enforcement, peer coaches, um, therapists, case managers, anybody, court staff, anybody who works is client facing and who works with people who are using drugs. I'm going to talk about how we can incorporate harm reduction into our practice and into our daily lives. And also going to really dive into the principles of harm reduction and what it means to live those principles.
One question I have, what do you think of the term harm reduction? Is there a better term?
No, I don't think there is.
Okay.
Harm reduction means that we are acknowledging that there could be harmful outcomes to the actions that we are engaging in. In this case, substance use. We acknowledge that there are risks. There's the risk of overdose. There's the risk of preventable disease like HIV and hepatitis C. We acknowledge that there could be potential harms, and we work to make sure that those are not outcomes that the people that we love experience.
I love the way you phrased that. I hadn't heard anybody say it so succinctly before, so thank you for that. I think a lot
sure.
what you do is health promotion as well. Is there anything we haven't talked about that you'd like to add?
I think I would just like to say that if this is your first time hearing about harm reduction or your first time actually giving it some thought, I understand that there's resistance to that, especially if you've been abstinence-based or have thought from an abstinence-based perspective most of your life. I understand that there can be resistance, and I want to say that I understand that because I was the resistant director of case management. I was the resistant peer coach. I was the resistant whoever. And it took a long time to unpack those things. And it's okay if you ask questions and you question it. Just don't stop learning about it. And don't stop questioning the things that are around you, because asking questions is how we learn more and how we expand our horizons and do better for ourselves and our clients.
Well, you have a fantastic spirit. I can't wait to meet you in person. So yeah, thank you for taking the time. This created another fan. You have another fan in me. So thank you for everything you shared, and continue the work you're doing.
Oh, thank you so much. I really appreciate you. I'm very excited to meet you in a couple of weeks, as long as we can both avoid getting COVID.
Yeah, I hope so. Take care, Corri. Bye for
Thanks.
now.